Now, whenever we try to prepare a tooth structure, what kind of objective a clinician needs to have before you try to align your burr and the operative burrs on the surface of a tooth structure? First and foremost, if you look at the diagram right before me, it would be a maxillary molar and the mandibular molar. The maxillary molar, nonetheless, is having a conservative cavity preparation with the preservation of the oblique ridge. But the mandibular molar is having a conventional cavity preparation where, along with the decayed tooth structure, the sound tooth structure, the buccal groove, the lingual groove, and the marginal ridge is inclusive of that. That being said, these are the prime important factors. We try to keep that into the picture whenever we try to go for the objectives. So first objective is try to preserve the tooth structure. That being said, the maxillary molar and the diagram has preserved the oblique ridge, which has got an extension to the mesopalatal to the distobuccal. The second one, the most important one, remove all the defects, whether it's going to be on the buccal, lingual, mesial, distal, or even on the palpal floor, and inclusive of the cusp and the buccal and the lingual third. So you have to remove all the defects. Then you have to make a tooth preparation. Whenever you try to remove the defects or the decay, the clinician has to prepare the tooth structure. When you prepare the tooth structure, you're trying to give a design to a given cavity. When you give a design to a given cavity, then comes finally your aesthetic placement of your restorative material. Aesthetic primarily applies to the composites and the glass ionomer cements. We used to have amalgam in the earlier days, but the amalgam nonetheless does not give an aesthetic appearance. So when we try to speak about allow for the aesthetic placement, composites, the tooth colored aesthetic restorative material, composites and the glass ionomer cement comes into the picture. So these should be the prime objective for every clinician or the student before you try to have a proper restorative occlusal harmony with the overlying tooth structure.